Hi, this is Dr. Stephen Bach. Today I'm following up on my previous presentation on coronavirus and Lyme disease and the immune system. As you probably heard, as of today, there are approximately 3,000 cases of COVID-19 in the United States, with about 60 deaths. So far, worldwide, there's close to 150,000 cases. Now, there's a larger mortality in China because of a couple of factors. Number one, a lot of Chinese men smoke, and there's a lot more pollution which can affect the lungs. In Korea, there's approximately a mortality of about 0.65%. And in the flu, you have about a 0.1% mortality. Now, remember last time I discussed the 3 S's: minimizing stress, getting adequate sleep, and staying away from sugar. Something that's come up now recently is the increased anxiety from the problem. And what happens is the best you can do is follow the CDC and health departments criteria for staying away from crowds. If you're coughing, cover yourself, your mouth, and do not cough unprotected. Clean surfaces, touch your eyes and nose as little as possible, and those things. Also do things to decrease your stress in your sympathetic nervous system by doing vagal things like meditation, prayer, laughter, deep breathing. These will all help. Now, in my next video, I'm actually going to give a meditation, which I call immune meditation. But first, what I want to do is talk about supplements that I am telling my family to take, I'm taking, and my patients. Number one is transfer factor. Transfer factor is derived from colostrum from women's milk and cow's milk. It's the exact same molecule. It's species, not specific. And what transfer factor does is it trains the immune system to react against pathogens and viruses and bacteria, and teaches the immune system to be more efficient. So this is paramount to take. The next thing is vitamin D. High doses of vitamin D are antiviral. The next thing to do is take vitamin C, 2 to 3 grams. If you're having any symptoms, you can up the vitamin C to 5,000 or 6,000. And if you have flu-like symptoms, you can take vitamin C to bowel tolerance. How you do that is you take increasing amounts every 20 minutes, every half hour, every hour, until you get to a certain amount, like 10 grams, 15 grams. And if you have any cramps or diarrhea, that's your bowel tolerance. You then take 3/4 of that amount that caused those symptoms, and that's your daily antiviral dose. The next nutrient that's antiviral is selenium. And the next thing I give is silver. You can give colloidal silver or nano silver in a nasal and throat spray, which you can do 4 times a day. And you can take oral silver 3 or 4 times a day. And the last thing on the list is 1,3 beta-glucan. Beta-glucan is a arabinogalactan. It's a starchy protein that's derived from yeast and mushrooms. And what it does is it coats the cells and does not let the virus attach to the cells. So these are some of the things that I think are really paramount to do to empower your immune system and for you to feel like you're doing everything possible. My next presentation will be on a meditation for the immune system. Thank you. Have a good day.